to evaluate right ventricular failure in relation with the left ventricular function?
Thank you. I think that's an important component because in many patients who have left ventricular failure, left ventricular dysfunction, left ventricular heart failure, this impacts on the function of the right ventricle, and this is because of the ventricle being closely interrelated through the muscle bundles, through the septum, and being contained together in the pericardium. So whenever we have a patient with left ventricular disease, heart failure with preserved ejection fraction or with reduced ejection fraction, or severe left-sided valvular heart disease, we need to assess carefully the function of the right ventricle, because in many cases this is impacted, and if we find signs of right ventricular dysfunction, this usually means a worse prognosis for that patient. So the way we do it, we assess carefully the level of pulmonary hypertension, because sometimes the impact is through the increase in pulmonary pressures, and we also have several means of assessing right ventricular function by imaging, usually by echocardiography in several ways, and of course whenever possible we can also use cardiovascular magnetic resonance, which has a very good accuracy in evaluating right ventricular volumes and function. This information would be very useful in selecting the best treatment options for these patients, and usually it comes back to a very good therapy for their left-sided problem, but in some cases finding right ventricular dysfunction is an important feature in selecting therapy. For example, if we foresee the implantation of the assist device, for mechanical circulatory support, in such cases, if one has right ventricular dysfunction, this could lead to complications of right ventricular failure after left ventricular assist device implantation. So making the correct diagnosis will lead to the best treatment of these patients.